So this is his thoracic spine. And some of these parts where they said there was fractures, they're just really the superior end plate is a bit dipped. And I'm not even worried about it, Dr. McCullough. If that was the only thing he had, he'd barely be seeing us.
Okay.
There's like a little crack in a couple of these, okay? But he didn't lose any height,
Good.
okay? So this will be no big deal,
Okay.
okay? This is what's bothering him the most right here. So here's our normal vertebrae. You see how they look like a marshmallow?
Right.
Okay, there's the disc in between. Here's our spinal canal. This is our broken bone.
Oh, yeah.
You can tell that one doesn't look right.
Right.
And you can tell he's a little bit, so you ought to have lordosis where you kind of curve and then straighten out and curve. You can tell we're a little angled there,
Right.
okay? Not in normal alignment.
Right.
The way this works is I can't change that, you know, unless we did a big surgery, and he doesn't have, we can measure the angles. He doesn't have enough to be worth it to go in and do a big surgery like that. Because anytime we do a surgery, we're going through tissue or manipulating things, it's never going to be the same. So if it's really bad, we have to correct it. Well, that's one thing. If it's not, we leave it alone. He ought to be able to get away with this. This should heal just fine on its own.
Okay.
Okay, the bone will look like this. You'll be able to tell 20 years from now, and they'll say, oh, did you ever have an accident? And you can tell them, yeah, when I was, young, I got thrown off a pole and flew in the air, and they'll be able to tell that was an old fracture. Okay.
How will that affect my work in the future?
I don't think it should. So your spinal canal is here, okay? Retropulsion means is the bone fragment shooting backwards. Because if it did, your spinal cord ends right around here, okay? How do I know it's on the MRI?
Okay.
And that's about normal anatomy, okay? So if it was really narrowing the spinal canal or risking hurting the spinal cord, or he had signs of a spinal cord injury, then sometimes we do have to go in and open things up and decompress so we can basically let someone heal. Luckily, he's neurologically intact. He didn't look like he hurt any of this, and I don't see any spinal cord injury or nerve compression on it. That's why we did an MRI.
Right.
Okay, so that tiny little bit of retropulsion, that's about 2 millimeters, you can get away with it. It's no big deal.
Okay.
Okay, what Dr. McCullough was saying yesterday is if we had to fix it, you have to go a level or two above and below with rods and screws to stabilize the fracture, and that's a pretty big surgery. Okay, and some of the new literature says on a young guy like that, you bring him back in 3 to 6 months, and then you take out the hardware. So really, you almost buy yourself 2 surgeries. Okay,
Yeah.
so versus if this heals on its own, the pain will go away with the fracture. Okay, and he ought to be able to get back to normal activity eventually.
Right.
Okay, it's a gradual return, right? So.
So this is the L1.
Yeah, so here's the sacrum, and so then it goes 5, 4, 3, 2, 1.
L1, yeah.
That's the
Where in my
L1.
back is that?
And this is a common T12 and L1. It's a transition level, so you start to have ribs at T12, and when somebody gets like a really bad hyperextension injury, a fall, a bad car wreck, these are the most common areas where it's just the way the force is. This is something's got to give, and
Right, and that's where it
this
goes.
is where it tends to give.
Where in my back is that?
It's probably right about here.
Yeah.
So you can feel if you feel your hips, that's generally like L4, 5, and you go a couple up. But you can be, this whole area can be pretty sore.
Yeah.
So this is, when you did this doesn't mean that's the only thing that's hurting. I mean, all your back muscles were strained by this. You can be sore all over. But when you have a fracture, I keep pointing, you can't see. So when you have a fracture like this, it's almost like gravel rubbing on gravel. It hurts to move, okay? The brace will sometimes help. It gives you external support, okay? It'll help maintain alignment and help the bone heal, okay? Do you have to have a brace? Some of the newer literature says maybe not, okay? But especially it helps the younger guys remind not to overdo it. So we use them a lot, okay? this was his MRI. So the MRI will show us the soft tissue a lot better. These are the discs, and this is a young, healthy back. So these are nice big discs full of thing. This is where we had our changes right here.
Right.
Okay.
Okay, and you can see that.
This dark thing with white surrounding it, that's the spinal cord with spinal fluid around it.
Okay.
Okay. As we get back here, you see this little blip of white right there. That was the epidural hematoma. And this is a little, the ligaments in between these are a little strained. Okay. It doesn't look like he tore a lot of the supporting ligaments, so structurally we ought to be okay to heal on our own. Okay. Why you always want to make sure is that's why we'll do some more pictures down the road, that if the ligaments truly are loosened, then we don't have a choice sometimes and you have to do surgery.
Okay.
But in the great majority of time, that's not going to be the case. That's why it's worth waiting instead of just doing it right away. Because most people can get away with having no surgery with a fracture like this.
Good.
Okay, especially in a young guy. So, and this is all down low. It looks different here because your spinal cord stops, and then it's all nerve roots that are in your low back. So we don't see any evidence of spinal cord compression, no evidence of spinal cord injury. He's been normal on exam since he came in. So that's the kind of thing we'll just leave alone and let it heal on its own. And this was his CT from this morning. There's his nose. There's his eyes. He had a tiny bit, you see how there's this kind of this white cloudy looking stuff? That was a little bit of what we call a subdural hematoma. The tentorium is like the, there's a connective layer that kind of separates some of the lobes. The dura is the covering of the brain. So subdural means in between the brain and the dura. You can have a blood clot, some little blood vessel tore from bumping your head really hard. If they get really big and put pressure on the brain, we have to go in and drain them. He was never really in danger of that. Where he had this, those very rarely get big enough to cause trouble. Okay, and his was already small in the first time, and it looks better on this scan.
That's good.
No big deal.
Good.
Okay, enough to not feel good, but not scary. Okay, so like I said, I think the big takeaway from all this is, I mean, as high as you sound like you got thrown in the air, that we got through this with relatively very, very healable injuries.
Good. Can I see his arm too?
Yeah, and I always joke I'm the brain and back guy. You don't really want me talking about arms and legs because I'm not good at it.
Oh.
That's the orthopedic surgery.
I just want to see what the
By the
arm
way,
looks
I don't know
like.
what I said yesterday. Sorry if I was just calling for my personal doctor.
Oh, you're fine.
That's the only name I knew.
Look, man, we deal with trauma. We're used to all kinds of stuff. So here it is right there. You see that?
Oh, right there at the...
Right there.
Gotcha.
So...
No, wait, right here?
These are normal joints.
Uh-huh.
But this bone should all be one piece.
Right. Okay, that's what
And
I
there's a
thought.
crack right there.
Gotcha.
And it's right there. You see that?
Yeah, I see it.
And so, same kind of thing, unless they think it's really out of alignment, which it doesn't look bad.
It looks pretty good.
Then most of the time, a young guy, and the joint doesn't look really effective. It's mostly a bone fracture. Then they'll just basically immobilize it and let it heal in a cast.
Perfect.
Okay. And always, if you have a family or friend or somebody that's an orthopedic surgeon and they have someone that they recommend or know, you could always go for a second opinion, even on the back problems.
Okay.
Okay.
So this is his radius?
Yes.
Okay. And then this is his...
I don't know where the other one is. I was going to say, like I said, I'm not exactly the...
That's okay. I'm just trying to figure out where on the arm it actually
It's
is.
his hand. So it's right here on the wrist, I think,
Okay.
is where that
Okay.
is. And where's the other one? This is the wrist.
Oh, there we go. Okay. So it'd be on this one here, right here.
Yeah. I think it's right there.
Oh, there.
You
Okay.
see it?
Got it. Mm-hmm.
They got a CT for better detail. That's why.
Gotcha.
Yeah. So really, look, his alignment, nothing looks
Looks really
bad
good,
there.
yeah.
So he kind of cracked the tip there. That's the non-orthopedic surgeon way of describing it, huh?
And that's just fine.
So
Okay.
the ulnar nerve goes in the elbow, but also comes to the hand and will give you some tingling. He had some tingling in his hand. I think that's what, maybe a hyperextension injury, something like that.
I also had a jacked up nerve already. I had nerve damage from the military in there.
Oh, okay. You had a trauma in that arm before?
Yeah.
Okay. So, that could be something we look at down the road, but his general sensation to light touch is intact. It's more tingling. That's what we call like a paresthesia. I'd leave that alone.
Okay.
A lot of those in 6 to 8 weeks will get
go
better
away.
and go away. And if they can, he'll end up seeing the orthopedic surgeon. They can kind of follow it from there.
Okay. Perfect.
Okay.
Perfect.
All right. So that give you a little more peace of mind?
Gives me a lot more peace of mind. Thank you.
No problem.
Yeah, Doc.
Yeah.
I know you're not a dentist.
Uh-huh.
Check out my teeth.
Yeah, we'll let the trauma team know. I'll be honest with you. I don't think we have even hardly an oral surgeon, unless it's like a jaw fracture that comes in. They'll probably have to get you to see somebody in a dental office.
I just haven't had a medical guy. We gotta get the fields checked up.
Does it feel loose?
I don't know.
In the back one? Okay. I'll let them know because the trauma team is like the coordinator for that. Nothing looked obvious on your CT, like missing a tooth or broken or anything. And there was no fracture.
Okay.
So it could just be, yeah, it could just be irritation. If it's like a peripheral problem, they'll just have to get you to follow up with the dentist in the office. Probably. Okay. All right.
Good.
Well, speaking of the trauma,
Is that the
we'll
team?
do rounds. If you see a big group of people coming around in the ICU,
Okay. Perfect.
we do like a multi-team round. And so, but I already told your nurse that from my standpoint, I think they were just waiting on the CT of the head.
Good.
With that tiny little head bleed, and I wasn't worried about it at all yesterday.
Wow.
That